To most, she looks like an average 20-something. And the reality is that she is. The challenges facing Chloe Smith, while invisible, are challenges faced by many Oklahomans.
I was diagnosed with bipolar and PTSD from sexual abuse and physical abuse.
The Oklahoma Department of Mental Health and Substance Abuse Services estimates that between 700,000 and 950,000 adult Oklahomans are in need of services. Of that number, few are receiving the care they need. Smith is one of those few. She says she's been lucky to receive a superior level of care due to private insurance through her employer. But with the decision to use her benefits came a number of hard choices.
Whenever I came to the thought that I'm going to have to commit myself to a mental institution, finances were the first thing that came to mind because I'm already a person who lives paycheck to paycheck. I'm a millennial. I don't have a huge savings to fall back on. So I had to research and I found the short-term disability option, for which I was very lucky.
Without her insurance coverage, Smith knows she may have had a far less positive experience with the Oklahoma mental health care system.
In Oklahoma specifically, I know the hospitals aren't so great. A lot of them are state funded, and so a lot of people will go in there and they come out worse than they were before because it's such a traumatic experience. I was very lucky in being sent to a private hospital because of my health insurance, but I so feel for those who weren't as lucky as I was and going to Red Rock or other state institutions and felt that they didn't get the help they needed.
A lack of resources in the state, paired with Oklahoma's high rates of trauma and the stigma surrounding mental health, may all be contributing factors to the state's ranking second in the nation for prevalence of mental illness among adults.
Whenever I got out, they did set a psychiatry appointment for me, but I missed it. So I won't be able to see a psychiatrist until mid-January. Which is a little worrisome because you're supposed to see them at least once a month. That way you can get all your meds refilled and such and make sure that everything's still working for you. But it just has to do with, resources, and there's too many people who need help and not enough people to help them.
One way Oklahomans are trying to provide for improved care is through the expansion of Medicaid.
It's so important to get help, and I know it's so scary, but don't be afraid to get help. I was afraid for so long after somebody had brushed me off, and it wasn't fair to myself to let myself live like that. You have to be aggressive in treatment. You have to be your own champion because nobody else is going to. If you don't advocate for yourself, your doctor, your nurses, there's nothing they can do for you.
Smith says that while there's no magic pill or quick fix, she plans to fight for a better future filled with more understanding surrounding mental health.
For those who have family members who you think may be struggling with mental health, just talk to them. Let them know that you were there for them. Let them know that you're listening. They may not be ready to open up to you yet about whatever their struggle is, but still stick by their side because the hardest thing for somebody is to get to that piece where they can acknowledge their mental illness or what may be a mental illness, and they will need you there.
From Oklahoma City, Janae Williams, Youth Central News.